the monkeypox, let's say, on planet Earth. It's discovered in 1958. It's discovered in monkey colonies. So that's why where the name come from. It's not because the monkey is the only one transmitting the disease, but because it's first discovered among monkeys. Actually, it's transmitted more with rodents and other small mammalian, African mammalians. In 1978, they reported the first human case. Also, it was in Congo, infected from an infected animal. In 2003, they reported the first outbreak outside Africa. It was in the U.S., and actually it's after imported rodents from Congo. When they import the rodents there to U.S., these rodents infect some dogs, which was sold after as a human pets. So 47 cases reported infected from these dogs, which were infected from the rodents. So this is like it was a small outbreak, but it's the first one reported outside Africa. In Africa, it's a kind of there is an on and off endemic happening in several countries. From 2018 to early 2022, there is a sporadic cases reported in Europe and US, and it's always it was linked to travelers coming from Africa, mainly Nigeria. Nigeria is it's really an endemic area with monkeypox virus. Till this month, earlier this month, when everyone started to ask what's monkeypox and what's monkeypox illnesses, due to the increased number or raising number of cases, it started in UK. The first case was in May 7th. It was in patients with recent travel to Africa. So there was no worries till May 14th, when 2 more cases discovered in UK, and there was no link to Africa and no link to the first case reported in May 7th. So, and afterward, there was a lot of cases reported in UK, and then in Spain and Portugal, and in small numbers in different European countries, then North America, Canada, US, and Australia. I think before 1 or 2 days, the first reported case came from UAE. So it's coming closer, but inshallah with no concerns. So this is the number of cases reported all over the European countries and North America. And this is a map, just show the number of cases all over the world. So about the transmission, so how monkeypox will be transmitted. There is an animal to human transmission, and there is a human to human transmission. Of course, till now, the human to human transmission is not that strong. It's we cannot consider it like a strong transmission. The animal to human transmission is happening through the bite from an infected animal or a scratch, or a direct contact with the infected animal, or indirect contact with the body fluids from the infected animal. The human to human is droplet, mainly droplets, with a direct contact with respiratory secretions, skin lesions, and contaminated objects touched by the infected human. So what's the signs and symptoms? We can divide the signs and symptoms into 2 periods, the invasion periods and the skin eruption period. The invasion periods is usually lasts between 0 and 5, and I'm saying 0 because sometimes there is no presence of this phase. It's immediately we start with the skin eruption phase. So this invasion period usually is with fever, headache, lymphadenopathy is very let's say, diagnostic and pathognomic to monkeypox illnesses, and it's happening like in more than 80% of the cases. Back pain, like a flu-like symptoms, back pain, myalgia, and lethargy. And then the skin eruption period, it began 1 to 3 days after the fever. It started in the face and spread to other parts of the body, but most of the recent cases now, especially the UK ones, it's started in the genitalia. And that's why most of the patients, they were first presented to the sexually transmitted infection clinics. So we have to pay attention for that. You have to pay attention for the atypical presentation of the monkeypox. Usually Usually the diseases start with a small macule. It can be like all over the body, or start in the face and then progress, or it's confined only to one area of the body. So it's not always like spreading all over the body. So start with a macule, and then the macule develop a papule, and then a vesicle with a liquid film, and then pustule, and then the crust, and then the crust will follow. Okay, so what's the case definition? I think this is very important especially for people working in ER and in outpatient clinics. So if you have a suspected case with fever or rash, and 2 or more of the signs and symptoms we mentioned, you have to consider maybe sending the swab for this suspected cases. There is a probable case where it meets the clinical case definition, not lab confirmed, but it has an epidemiological link. So there is epidemiological link to a confirmed or probable case. Confirmed case, of course, it's either a suspected or probable, but it's confirmed with the lab. There is epidemiologically linked case. Well, the close contact, it has a close contact to suspected or probable or confirmed cases, and it has a recent travel to Africa or any of the countries recently reported cases. So reporting really, maybe it's the most important thing to do now. So all suspected cases must be reported. Of course, you report it to infection control, and then we will report it to Hassan. Hassan is the surveillance system of the MOH, or by email to MOH also. So please call the infection control. So early recognition and source control, this is, as I mentioned before, this is maybe the most important things to do now. Healthcare workers should be aware of the signs and symptoms. You should be aware of the atypical presentations of the infection. We have to use like signs to remind health workers about the signs and symptoms, maybe to hang it there in the outpatient clinics and in ER. Respiratory hygiene should be applied to all visitors. And I think respiratory hygiene now, it's not an issue with us. We all used to it, and we are doing it by default. Whenever possible, patients who are identified as suspected cases should be placed in a separate area from the other patients. So we have to be strict with the, this is maybe a good opportunity to remind everyone about the hand hygiene. We've been doing projects to improve their hand hygiene, still with a little improvement. So please remember your hand hygiene. It will cost nothing and affects like 100%. PPEs, sharp safety. PPEs also to remind the administration that we should supply the critical areas with the PPEs. Aseptic techniques, environmental cleaning, and disinfection. So all suspected cases should be placed under airborne for now, droplets and contact precautions. Of course, the patient placements, if we have a suspected case or a confirmed case, we should place it in a negative pressure room. If there is no negative pressure room, we'll place the patients in a single room with a portable HEPA filter. If there is no single rooms, we can cohort the cases together. But this is like a really, you use it when really there is no solutions. The PPEs, again, to remind everyone about the PPEs, the donning, the doffing, in the correct sequence. You have all of the health workers should know how to do it. You should do the donning prior to entry and doffing prior to exit. You use the disposable gowns, the masks, the goggles if it's available and you're expecting splashes from the patients, and of course gloves. About the transportation inside the hospital, we have to restrict the patient's movement across the hospital as much as you can. And use a portable machine if it's possible. Always notify the area that we are having a suspected case or a confirmed case of monkeypox, so they will take all the precautions. And those who are transferring the patient should be also with the strict precautions. This is about the environmental cleaning and disinfecting. So we should do strict to that. Avoid shaking the linens to prevent the spread of infection. So the sample collection, how you will do the sample collection. So we'll collect the appropriate sample type to seal the sterile container. Sample age, usually we send like 3 samples from different regions in different parts of the body. For the swab, you use a sterile nylon, polyester, or vacuum swabs, no cotton swabs. Label the specimen with all the essential information. If you use a multiple specimen, you have to indicate the site and the collections with all the information. This is for the storage, so this is for the lab. When you do the test, please wear your PPEs, and you have to gently deroof the vesicle, and then rub the base of the lesion firmly. Just try, like back and forth, just try to get more DNA of the virus. Okay, so you have to scrub it firmly. Sample at least 3 lesions, and place the swab into, as I mentioned before, and label the tubes, and then use a waterproof dressing to cover the deroofed lesions. For the treatment, of course, most of the cases reported till now and previously, usually it's mild cases. It's need only supportive treatment. There is, in the previous cases, a use of antiviral medications. Here we don't have those antivirals in Saudi till now. So maybe we would have to, if we have any updates on that, we'll update you. So my advice to all clinicians, just be vigilant about the possibility of monkeypox if characteristic rash is present. So rash is present in 95 to 100% of the cases. Know the illness may present atypically, so be very, very vigilant. Many patients have a mild disease. It's easy to confuse with sexually transmitted infections and varicella, so we have to put this in mind as a differential diagnosis. Always obtain a good sexual and travel history. And if there is any contact with someone who has the similar rash, obtain specimens and notify the infection control for reporting. General updates about the monkeypox. Patients are infectious from the beginning of the symptoms till the scabs off. But there is a lot of studies mentioning about prolonged shedding, but more than that, which extend maybe 2 to 3 weeks after the scabs off. We have now, till now, this is the recent updates, more than 250 confirmed cases worldwide in 14 countries. WHO said it's a containable situation. No need for isolation or mass vaccines for now. The contact tracing, maybe for now, it's the only thing we will do, and it should be enough. Experts say it's no lockdowns, so just to relax. About the effect of the smallpox vaccine. So we know that maybe the last smallpox vaccine was given in 1975. So who took the vaccine in 1975 is 47 years old. So the people who are 47 years old and older, they are the only one immune for the smallpox. The issue with the smallpox, we don't know now. It should be immunogenic. It should give some immunity to monkeypox, but we don't know how long is this immunity. So if someone has took the vaccine before 47, 45 years old, is he still immunogenic, or he got an immunity for the monkeypox or not? This is the question. But for sure, smallpox vaccine has some effects on monkeypox infection. Moderna now started a trial. Actually, it's not now. It's like in 2018 they started clinical trials on the monkeypox vaccine. I'm not expecting like the vaccine will be in dramatic things like COVID. It should be way easier than that. Thanks. Any questions?
About the MOH piece, are the swabs available now in MOH, or where should we start if we want to check on a patient?
Yeah, so
how can we do the swab?
If you have the suspected cases, you will do the swabs, and we'll send it to the regional labs.
So actually, are the swabs being distributed now, or is it
should be
any kind of vacuum or polyester swab?
Yes,
can do the
can be.
treatment?
Yes.
Okay, I have two questions. Number one, if the size of the microbe is larger than the COVID virus, so what is the need of having airborne precautions and airborne isolation?
Yeah.
Since now the COVID, there is no proof that
Yeah, no
it is
proof.
transmitted by the airborne group, but still we do it.
Yes.
Of course, it's a bad thing. But for this virus, it is very unlikely to be transmitted through airborne group.
Yeah.
So why you have to have that?
So because there is no conclusion on that, and because they might be, I'm thinking they might be following like it's like a chicken box. So that's why they add negative pressure or the airborne isolations. It's transmitted by droplets. So this is a very controversial thing. I mean, I think they put it this early on for more precautions till they figure out what's the story, what's the true story. Maybe because it's like a chicken box, so they are following the same infection control precautions.
Okay, second question, what about the respiratory infection of the virus? Because you didn't say here any respiratory problem.
Yes.
Any chest X-ray findings, any...
Yeah. So one of the rare complications. So as I mentioned, most of the cases are with very mild disease. So pneumonia or pneumonitis is one of the rare complications. Like, and it can cause myocarditis, it can cause encephalitis, but this is like a very rare and reported in a very few patients all over the previous years.
So logically, the main route of transmission is contact.
Contact and
Yes. Respiratory is...
yes, but it's getting in your secretions, so droplets. Yeah.
I wrote that one, there is such a horror all over the world.
Yes.
A virus discovered in
50s.
1957 or 58, and only 58 cases
Yes.
all over the world.
Yes.
Why this
Yeah. I think part of it is changing the mindsets of people and changing the culture all over, especially after the COVID epidemics. This virus were hanging there in Africa, doing on and off endemics there, and there was no concerns. But now when it's spread to other countries, they are wondering, and without link to Africa, without link to any patients coming from Africa, that's what raised the concerns. Is this like a mutated virus, or it's a virus is now changing in a way that we have to take more care of that? Plus that now the world now is nothing like before 10 years. It's everything changing now.
Many cases discovered in UK, you remember, with malaria, where they came from, and there is no more widespread all over the world, and the WHO.
Malaria?
Malaria is a terrible.
Yeah.
Even malaria has been spread into finding patients that are positive.
Yeah, but malaria, you cannot say like it's the mode of transmission is way different. You can't contain it immediately. So it's a bit different from malaria to this. Now it's transmitting from easily and not like before. It shouldn't be like easy to transmit this virus between humans. And now it's more cases are coming. So that from this point, I think the concern is coming, and everybody's trying to raise a concern. But I'm not expecting it will be something like COVID or near COVID. It's it will not reach there.
Social media will go to
I don't like the conspiracy things about diseases, but everyone has his way of thinking. Yeah, so the disease is more severe in pediatrics. It's not like COVID. So the more risky people are the children, especially under 8 years of age, the pregnant ladies, the immune compromised, those group of patients who reported to have like a more severe disease.
High-risk population. Okay, whatever opinion you want.
Thank you so much. I
You're
think
welcome.
it's a very good talk about outbreak here.
Yes.
Very responsive talk to the outbreak. عندي سؤال أول حاجة lethality of virus. يعني ما سمعت it's like how bad is it? Is it like a killer like COVID? بالنسبة للريسكيول is it permanent disfiguration ولا just gonna be gone without any scar? حاجة الثالثة why do we link it in media to the homosexuality والأشياء ماني شايف for scientific things إنه له علاقة بالشيء.
No, again, it's not a sexual transmitted disease, but because most of the cases reported in UK were discovered among gays and MSM, men having sex with men. That's why the concern raised about maybe, we cannot say it's a sexually transmitted infection because the mode of transmission is by close contacts. So any close contacts by any means can transmit the infection. But because most of the cases in UK were first presented to the sexually transmitted infection clinics because they thought that it's maybe syphilis or herpes, the presence of rash only in the genital and anal area. That's what make us talk about that you have to have it when you have a sexual rash, a genital rash. You have to think about it may be monkeypox. About the rash itself, so before they said the pruritus, it's usually like a chickenpox, but now for the new cases they mentioned that the pruritus is not really prominent like chickenpox, so it's less pruritic. About the disfiguration, I'm not sure about that. I didn't read anything about the disfiguration, so I'm not sure about that. Okay. Thank you so much.
Thank you too.
Thank you, Dr. Abir, for the presentation.